presenting on multiple endocrine neoplasia, and we're really happy to have you here. So whenever you're ready, you may begin.
Hello, everyone. So today I'm going to be going over a topic I've researched, which is multiple endocrine neoplasia. So here's just a basic outline of what I'll be talking about today, and I'm just going to get started. So what exactly is multiple endocrine neoplasia? Well, it's when multiple glands in the endocrine system are affiliated or afflicted with tumors and cancer cells that start wreaking havoc on the body. The endocrine system is composed of different glands that secrete various hormones which travel through your bloodstream to control different aspects of your mood, growth and development, organ function, metabolism, reproduction, and stress response. So when these processes are disrupted because of the tumors present, your body will face fatal consequences. So even just putting aside its severity, the condition is very, very complex, as different combinations of tumors create other forms of multiple endocrine neoplasia, or MEN. And I'll be covering the most common types, which include MEN1, MEN2, and its subtypes MEN2A and 2B. The condition can be diagnosed with genetic tests, which would analyze the patient's DNA for any mutations. Blood or urine tests could also be taken to measure hormone levels, and imaging tests like an MRI or CT scan can confirm the presence of tumors on specific glands. Now, before we understand how multiple endocrine neoplasia tumors work, we need to know where they're located and the processes they disrupt by the tumors forming on those glands. So the gland on the top left here is the thyroid gland, situated at the base of the neck. It collects the iodine within the food ingested and secretes hormones that regulate the body's energy. The yellow circular portions of that gland are the parathyroid glands, which are actually on the backside of the thyroid. The parathyroid secretes hormones that regulate the calcium and phosphorus levels in your blood, and that is one of its main functions. And once again, it kind of works hand in hand with the thyroid gland. The pancreas directly, which is located right here, it's located near the liver and stomach and is responsible for creating enzymes and hormones that help the intestine to break down sugars, fats, and starches that go through your digestive tract. Most importantly, it produces insulin, which is beneficial, and it's a hormone that stabilizes glucose levels in your body, and you've probably heard it when people are discussing diabetes. The pituitary gland, which is in the top right corner, is located in the thalamus, which is in the brain. It is a significant component of the endocrine system because it produces almost all of the hormones that regulate functions in your body, and it tends to every other gland in the system. It's sometimes even called the master gland. Finally, the adrenal glands, which are on top of the kidneys, help regulate your metabolism, immune system, blood pressure, response to stress, and other essential functions. And it's also mainly known to produce adrenaline, which controls your fight or flight response and kind of gets you, excited or ready to face a difficult or scary situation. So now we will discuss the cancer cell formation. So the gland to the left here is the thyroid gland. And this image here represents a cell making up a gland that needs to replicate. So the cell here is just one of the many cells that are in the thyroid gland at the moment. And these cells need to continuously replicate again and again and again in order to keep up with the thyroid gland and allow it for its hormone production and functions to continue. And they'll keep dividing, and you can see how rapidly they are dividing. Now, with this rapid replication, errors can occur, specifically genetic mutations that produce this purple or cancerous cell right here. With this formation of a single cancer cell, it is essential to remember that the condition is multiple endocrine neoplasia, which means the same mutation that occurred in the thyroid in that example there is happening in a different gland at the same time or at a different time, but it's both producing dangerous tumors. So that cell has bypassed checkpoints that the normal body cells go through to make sure they are not facing mutations. But this purple cell here, it bypassed the checkpoint and it formed entirely. So it will continue to replicate as the other cells around it do, because that's what it's programmed to do to meet the thyroid's needs here. So it just continues to replicate again and again until you have a huge surplus of these cells. And there's suddenly a large mass that is built up because of these excess cells that are not supposed to be there. So this mass is the tumors you see on these pictures here. There's one on the adrenals, the thyroid, the pituitary, and the pancreas. And you can see on the pancreas, there's multiple. So that's just specifically to one gland, but imagine that many tumors on the multiple glands in the endocrine system. So there are different types of tumors, and the main two types that you probably have heard of before are benign tumors and malignant tumors. So these cells, as they begin to grow and change, both types of tumors can form. Additionally, since these tumors are present in endocrine glands, hormone production can actually be affected in these cases. The tumors can be classified as functioning or non-functioning. Functioning tumors actually begin making hormones in conjunction with the gland independently. So picture the thyroid gland making hormones and then a tumor on top also making hormones. So it completely changes the flow or output of hormones being produced. And then there's a non-functioning tumor that do not produce hormones and are just kind of on top of the gland, as you can see in any of these pictures here. So all of this disrupts the precise hormonal balance that keeps the body working correctly. So now we can discuss the different forms of these tumors. To start, I'll expand on type 1 multiple endocrine neoplasia or type 1 MEN. As I previously mentioned, tumors arise because of genetic mutations. With type 1, the patient has a cell with a mutation on the MEN1 gene. This gene produces a protein called menin, and it's actually a tumor suppressor. So when the MEN1 gene mutates, menin is no longer made, causing anything to defend the body from tumors to just vanish. There's nothing there left to suppress or stop the tumors from growing, which allow MEN1 to even happen. All of these tumors happening on the different glands. The specific tumors involved in type 1 are parathyroid, pancreas, and pituitary tumors. The parathyroid tumor is commonly a functioning tumor. Again, that just means it also produces hormones in conjunction with the parathyroid gland, and it produces an excess of the parathyroid hormones, leading to high calcium levels in the blood and even kidney stones. So the pancreatic tumors have higher levels of enzymes, causing excretory issues like digestive issues and ulcers in the kidney. As I mentioned before, the pancreas monitors glucose levels, and cancer can occur in these locations, obviously, right? And they also may produce conditions like hypoglycemia because of the pancreas issues happening with the enzymes. Finally, with pituitary tumors, more reproductive functions are disrupted in men and women, such as menstrual or even breastfeeding abnormalities in women or erectile dysfunction in men. Pituitary tumors can also result in more than needed growth hormones being produced, causing a condition known as acromegaly in adults or gigantism within kids. And with that, there's actually attached symptoms because the bone and honestly all of the limbs start growing at a rapid rate, which is why it's categorized as gigantism. It just leads to tons of body aches and pains, as you could understand, with the body rapidly growing faster than it needs to. To move on to type 2. So this one contains way more physical symptoms that a patient may observe physically. So most of these symptoms that are associated with this type, you can actually observe and see and almost self-assess before going to a doctor maybe. So the genetic mutation that happens with this type, which is type 2 again, occurs on the RET gene or RET gene. This gene is responsible for producing or providing instructions to make proteins that are involved in signaling within cells. So this cell signaling is actually really crucial because most of these cells that are signaling can occur during replication. So imagine two normal body cells trying to signal to each other that maybe we need more cells being replicated. And suddenly, since this RET gene or RET gene has been mutated, they are not able to signal each other and not enough molecules or cells are made anymore. So it causes the protein to become overactive in some cases or even underactive, like I just mentioned. The tumors involved are formed in the parathyroid, thyroid, and adrenal glands. And within type 2 MEN, there are two subtypes, 2A and 2B. Mainly, they differ because of the symptoms. I'm telling you, the symptoms in this type are very, very harsh, and that's really the only way you can differentiate the two different types. So again, the parathyroid tumor, like I mentioned for type 1, they're the exact same symptoms here with the calcium issues and kidney stones being prevalent. Type 2A specifically contains an adrenal tumor called pheochromocytoma, and these will cause the patient to display high blood pressure and jitteriness as the adrenal gland will be overworked. As I mentioned before, adrenal gland produces adrenaline. So imagine the adrenal gland being super overworked and overstimulated and producing way, way, way too much adrenaline that your body doesn't know how to respond and just acts, super jittery, super crazy. You can't really control your actions because of the amount of adrenaline. The patient will also have small saturated bumps on different part of the body because of the hormone imbalance. So hormone imbalance also usually works with the skin. And sometimes these tumors create issues under the first layer of skin, producing these bumps here. And again, these issues will occur because of the hormone imbalances. So with type 2B, thyroid tumors or the pheochromocytoma, and neuromas or the growth around nerves are present. So these symptoms are very, very harsh. So type 2B is less common than 2A, but has very severe symptoms, like I just said. The neurons, which are the neuromas, right, the growths around the nerves, create bumps on the lips, the tongue, the lining of the mouth, and the patient's eyelids and lips may swell as well. There can also be spinal, skull, feet, and thigh abnormalities. So again, I'd say out of all of these types, in my personal opinion, 2B is probably the worst because of the amount of symptoms that are associated with it. And some of these symptoms can go to the extreme, where this is a bit graphic, but the lips can even go inverse because of the amount of swelling that occurs. So that is the type 2B of that. So with, you guys able to see the diagram? Um, all right. As I previously explained, MEN can be inherited condition. It can be inherited from a family member, and it's caused by mutation in a specific gene as the gland's cells replicate. So most of the time, the mutated gene is inherited from an affected parent, while other cases result from new mutations in the MEN1 gene, where an individual is the first person in the family to be afflicted with the condition, meaning they are the first person to have that gene mutated, and no one else in their family has ever faced that. So they kind of started the lineage for this type of inheritance. In cases of specifically inheritance, the mutated genes have an autosomal dominant pattern, and this just means that you can see here on the diagram that even if one parent has the mutated gene or is afflicted with MEN, there's a 50% chance of their children having it as well. So if both parents are affected, that would mean 100% of their children would display MEN. So this just shows the autosomal dominant pattern again, and it just shows it really creates a big amount of impact. And actually, with both of these two types, type 1 actually shows up in 1 of every 30,000 people. Type 2 is 1 out of 35,000. So you would think it's not a super concentrated or frequent disease, but compared to other diseases, the 30,000 huge amount is actually pretty substantial. So this brings me to my next point of pre-surgical treatment. So patients that see these symptoms, as I mentioned before, likely have been to a general physician and they've expressed their concern, like, what are these bumps on my arm, or whichever slew of symptoms. And the general physician would probably refer them to an endocrinologist, which is a doctor who specializes in endocrinology. They would do this because of the clearly hormonal symptoms that are appearing. So after they've been referred to the endocrinologist, the doctor would make sure or determine if the patient exhibits MEN by doing genetic testing. They'd first confirm that the patient themselves has it, and once they display true factors that they do, the doctor would have to be testing the rest of the family as well, because they could also exhibit the gene or mutated gene or even the tumors themselves. And as I mentioned, it's a very dominant trait. So majority of the time, it is a hereditary condition. So the rest of the family would show the trait for the MEN mutated gene. The endocrinologist will then monitor the patient's tumor once confirming that they do have it, and will prescribe targeted medicine therapy in certain cases to see if the cancer or at least the symptoms would subside. So you have to think about this as well, the benign and malignant tumors. When you think tumor, you probably think it has to be surgically removed instantly. There are actually some patients who would rather not go through the complications of surgery to remove a benign tumor and would rather just take, again, targeted medicine therapy to get rid of the symptoms associated with it. So, again, some of the cases can be benign, which the doctor would have to consult the patient to see if they'd like to get it removed, but others can be aggressive and malignant tumors that severely must be removed by surgical means. So that brings me to a video here, which will talk about a little bit more of the treatment on the surgical side, and endocrine surgeon Dr. James W. Sulibrick will explain that here.
Surgical options for treatment of endocrine neoplasia represent removal of the tumors in the affected glands. We can perform minimally invasive parathyroidectomy, minimally invasive thyroidectomy, scarless parathyroidectomy, or scarless thyroidectomy. Sometimes those minimally invasive options are not possible because of advanced nature of disease. In those cases, we perform traditional parathyroidectomy or traditional thyroidectomy. If we need to work on the adrenal glands, we will do that with a laparoscopic or a minimally invasive approach, which is possible in 90% of cases.
So just again, if you want to clarify some of the terms he used when he said thyroidectomy or anything ending in ectomy, it's meant to completely remove the gland. And by removing these glands, it would be difficult to recover for a little while, but your body should be able to work without them with supplements of different methods of dealing with those processes. So he kind of also mentioned minimally invasive procedures, which is kind of a middle ground between the medicine therapy and complete surgery or removal of those glands. So again, those procedures are just partially invasive. They wouldn't be as risky to complete on the patient. And you just need to make sure that you remember that most of the tumors that are removed by surgical means are if they appear to be type 2 multiple endocrine neoplasia or type 2 MEN. So just to clear that up a little bit, MEN1 is definitely severe, but MEN2 obviously produces way more symptoms that could be life altering on the patient. So type 1 isn't seen as a bigger uh, type that needs to be surgically removed, and most of the time they can be controlled a bit with the medicine part of it. So, come to a conclusion. Now, why is all of this important? Why did you need to learn about multiple endocrine neoplasia today? Well, ultimately, multiple endocrine neoplasia is an extremely fatal condition that can really only be treated by surgery, which has its own complications. My purpose for this presentation was to explain these dangers as mutations in a gene can occur spontaneously and generate deprecating issues in your body. MEN is very complex, and even the tumors themselves, their symptoms can be their own separate conditions like Cushing's syndrome and all of these separate conditions that by themselves are really, really dangerous, and combined with multiple conditions like that just prove to be very life altering to a patient. So by spreading awareness of this critical issue, I'll possibly be saving anyone from ignoring the symptoms and signs of this condition and hopefully understanding that they do have multiple endocrine neoplasia. Thank you. So just to answer some of the questions, so the main reason that I started researching multiple endocrine neoplasia was because I had been researching multiple endocrine conditions as I was, but they were a little less severe, I'd say, like hypothyroidism or diabetes. I was looking at those before. I fell upon this and I was completely just kind of exposed to this way higher level of conditions because I never thought to think about how tumors affect endocrine glands and how severe that could be. So that really just threw me into the topic. Um, are there any environmental factors to developing MEN? So some environmental factors can occur, but it's mainly just the mutation. So any protein that could occur, like example, I was talking about menin, proteins can be denatured by high heats and things like that, but that's honestly just for cell biology and not really would affect a patient per se, but environmental factors, I would not say it's a super big impact. It's mainly hereditary, like I mentioned. And yeah, it's mainly just hereditary. So there is a fourth type, but it's very, very rare. It's more rare than any of the other subtypes as well. And it contains another mixture of the glands. So I'm certain it contains the thyroid, pituitary, and parathyroid again. It might also contain the pancreas, but again, it just contains a different mixture of glands, and it's super rare, which is why I thought just to include the main ones. And I also just wanted to emphasize that these types that I shared with you, MEN 1, 2, and 2A and 2B, the glands that I mentioned as a part of those are the glands that are involved 98% of the time, because it's the most common. In those types, there are still scenarios where, let's just say MEN 1, one of those glands is not involved. Like MEN 1 has the parathyroid, pituitary, and pancreas. If the pancreas isn't involved, the doctor may still classify it as MEN1 under specific conditions. So these are just the most common types and the most ways you'd be able to see it. But yeah, if there's any questions, again, just put them right in the chat. I'll answer them.